In this video, I'm going to teach you my guru's approach. For those who don't know my guru, it's John Murtha. I love him, I respect him, I like him so much. If I see him, I will touch his feet in front of any number of people. The reason I say this is when I was preparing for my exam, I had no one to help me, and the only person who was actually with me was John Murtha in his book. Every day I start reading my book, I look at his picture, and I think he is with me all the time. That's the reason I have a great respect for him, because at that time I was very anxious, stressed. You can use every word like depressed. I was not sure what will be my life or my career, and the only person that was with me throughout my preparation was John Murtha. So I like him. I'll just move into his approach. So this is an approach he writes in his books. So this is how he starts. Like, he will start with probable diagnosis. So when you look at a symptom, always think what can be the probable diagnosis, or what are the usual diagnoses that can be associated with this symptom. Then the second thing he writes is serious disorders that should not be missed with this symptom. This is also very important. It's more or less a bit overlapping with my routine and red flag approach, but this is his approach, and he writes about pitfalls. These are the rare disorders that can present similarly, so you may miss these things. Then he talks about 7 masquerades. Very important, depression, diabetes, drugs, anemia, thyroid, spinal dysfunction, and UTIs. These are the 7 masquerades you should be thinking in mind, when you're actually thinking about the differential diagnosis, or when you're brainstorming about what could be the reason for this symptom. And the final thing is the patient trying to tell me something, whether he has stress at home or at work, or is it like malingering, like yellow flags, conversion disorder, does he have lifestyle issues? So if you want to, read in great detail about this particular approach, make sure you read his book. He has written this 5 steps for each and every symptom, and that will be very helpful, not only for your exam, but in real life as well. I have this book every day with me. Anytime I have a doubt, I'll just go through this book. Okay, so make sure you read all these 5 points for each and every symptom. Make a rough notes, and that will be very helpful.